Okay, here we go. Hi everybody, it's Dr. Magnifico from Vet and Polly.com. This is Shyla. She's a chocolate lab. She's 9 years old. She has a cyst on her neck, so on the right side of her neck. It's this big, so it's about the size of a lemon. She's had it for quite a long time, and we've actually drained it a couple times. I'm really not a fan of draining, well, just about anything. I'm fine with draining if you're trying to figure out what's going on inside. So if we're not sure if this is infectious, meaning there's pus in there, or if this might be some kind of cancer that we're trying to do an aspirate of. But, if this is a cyst, which we are pretty sure this is because we've drained it twice already, you should just get rid of it. She's having a problem now in that the skin is so thin that it's actually starting to rupture. She's rubbing it and it's starting to rupture. So you can see right here how thin the skin is. At some point very soon this is going to rupture, and then it's going to become a chronic non-healing wound. So I just spoke to her owners, and we are talking about taking it off, and they're going to take it off really rather soon. Because it doesn't really have a wide base, it probably will come off pretty easily. At my clinic, this is probably a $300 procedure. If it looks like it's a benign cyst, sometimes we don't send it in for biopsy. Everything that you take off in the veterinary world should be biopsied, but in some cases that's not feasible. That's $200 here, so that's about half the cost of taking care of it, so we may elect to decline that. I'm going to drain it now, so I just wanted to show you what our procedure for that is. We're going to give it a quick scrub. Oh, actually you've got the clippers, yeah. We're going to shave it just so you guys can see just how thin the skin is getting. It's really, chronic irritation and chronic stretching of the skin causes it to become weakened and abnormal, and at some point very soon it's going to rupture. So all of this redness is just the skin being stretched to the point where it can't support the structural infrastructure of the skin anymore, and it's going to rupture, and then you have to worry about flies getting in there, chronic non-healing wound, and infection, because now we've got an open wound. So we are going to use a butterfly and hook it up to a syringe. And then we'll probably need some sort of thing to empty it into. So you will rub. Okay, so when we talk about trying to identify what's going on in there, this is what a cyst looks like. It looks like this kind of straw-colored fluid. So this is draining a cyst. Everybody wants to drain it because then it goes away and they think they're happy. Really, my concerns are every time you poke it, you introduce infection. And in some cases, it's just going to refill just about as quickly as it came. We've been doing this every couple of weeks. So at this point, it's just time to take it off. If she's refilling her cyst that quickly, then it's a problem, and it's a time to resolve that problem. So we are going to get this taken off as fast as we can. If you have any questions anytime, you can find me here at Vet or Polly.com. Take care.